We've had a lot of questions this evening. And to get us started off, we've had a number of questions regarding when receiving a referral to a dermatologist, what would be some questions that would be important to ask to ensure that their focus is on skin cancer? Do you feel like there are important questions that a patient should be asking when they are going to see a dermatologist to know, are they the right one for me? Yeah, just interested in your thoughts, Dr. Wiese.
Yeah, I think there's a few things. Maybe the most important is, that if you've been diagnosed with a skin cancer, I think it's important that you need to have a copy of your histology report, so that it's important that you know what type of skin cancer you've had, that you can look at the margins. I think it's always just important to have that, because sometimes, what I see a lot is patients would tell me, yes, I've had some form of skin cancer. I don't know what type of skin cancer it was, and I can't really remember what was done. And I think in that sense, it's always good just to have a copy of those. We all move around these days, and I think in that sense, it's just always good to have those type of reports at least. Or even if you've seen, let's say, a specialist, let's say you've had Mohs surgery, or even more so, if you've had, chemotherapy or radiation. I think those type of reports, not all of them, but I think just to almost have a summary of that, I think that is important. And I think also it's important to, when you see your skin cancer physician, is just to ask what do they think, what's their thoughts on your risk, because I think sometimes it's really important to be concerned about your skin, but sometimes, we don't have to be as concerned about our skin. I think it's always important to protect our skins, but we also want to make sure that we're not worrying unnecessary, because there's definitely always concern. And I think in that sense, getting the guidance of your physician to say, but actually, what is my risk, and how concerned are you about my risk for getting skin cancer, or even getting, let's say, skin cancer again?
Thanks so much. And just to go off of that, we've had a few questions just talking about having an established relationship with a dermatologist, and that dermatologist may be retiring, and how to ensure a smooth transition. So when transitioning to a new dermatologist, to make sure that you are being well supported.
Absolutely. I think there's two things there. I think, dermatologists are, of course, or skin cancer physicians, of course, are really important. But I think we still need to remember that the backbone of your health is still your family doctor. Your family doctor is still your quarterback. He or she is the one that really organizes everything for you. But in that sense, what I probably would recommend is asking your dermatologist or skin cancer physician that you're seeing for copies of your file, because that immediately just means that, there is a time that you might not actually see somebody, or when you see your new dermatologist, then those files need to be transferred, or the question is, where are those files? Is it in storage somewhere? And it's always just nice, to actually have a copy of your file, so that when you see your new dermatologist or skin cancer physician, that you can actually just give them a copy of that, or even better, beforehand, drop it off and give them some copies, just so that your physician can actually just get an idea of what was done on your skin, what your history. So I think just to be involved in just managing it yourself in that sense.
Great, thanks. And another question from one of our attendees is, they had melanoma over 20 years ago and currently have many moles on their body. How often should they be checking their skin with a dermatologist or with their annual checks? What would you recommend?
Yeah. So unfortunately, I think we need to remember there's two reasons why people get melanoma or skin cancer. The first is UV rays. Of course, we know that when we expose the skin to UV rays, then your risk of getting skin cancer is higher. But the second is also genetics. And this is where typically what we're seeing is if you don't have a lot of moles, then you can probably tolerate much more UV radiation before you're going to get before you're going to get skin cancer. But if you are very moly, and that means that you don't need a lot of UV rays to get another skin cancer. But of course, what the question here is, what is the time frame? And what we do know is that the older we get, the higher risk we have of getting more skin cancers or melanoma. So typically what I do is for my patients is I tell them that if they've had melanoma, it all depends also on the type of melanoma, and again, the breast thickness, if it was a melanoma in situ. There's no specific guidelines on what the follow-up should be, but my recommendation always is, we live in Canada, it's not going to cost you money to see a physician, so my recommendation always is at least once a year. Is a good idea just to get somebody to check your skin. Now that, again, that doesn't need to be a dermatologist. That can also be your family doctor that can just have a look. But unfortunately, if you've had melanoma once, your risk for getting melanoma is always there. And especially the older we get, that just means that our risk is higher in getting a second or third melanoma again.
Thank you. And our next question is regarding sunscreen. So if someone is outside for an extended period of time and they'll be going in and out of a building, should this sunblock be applied every time going outside, or is sunblock only good for only outdoor users, or should we be concerned about wearing sunscreen if we are going to be inside most of the day?
That's a good question, yeah. It all depends on if the patient has applied and used the sunscreen correctly. So the simple answer is if you've used your sunscreen correctly, you've applied it correctly, you've used the correct volume of sunscreen, then no, you probably don't have to reapply. But if you just put this little bit of sunscreen on your face, let's say, and you are in and out, then probably I would recommend to reapply every 2 hours. But research has shown that we typically only need to put sunscreen on once a day. Part of the reason why the recommendation is to put it on every 2 hours is because we know that we're not using enough sunscreen. And that means that, when you're going to reapply every 2 hours, there's a very good chance that at least, cumulatively, we will get to the point where we actually protect the skin. But that's why I always tell patients, rather just use it, in the morning when you wake up, wash your face, brush your teeth, immediately put sunscreen on, and then make sure you use enough, and then you're good for the day. But of course, again, if you swim, if you sweat, then this is where, then yes, absolutely, we need to reapply.
Thanks. And in your experience, how frequently do you see a melanoma in situ appear in the scar tissue of a previous melanoma in situ that was removed with a wide local excision? And does one reoccurrence increase the likelihood of another?
Yeah, that's luckily, with the melanoma in situ, the question immediately would be is how was it treated? Because again, depending on how it was treated, we do know that, let's say, the difference between doing a 2 millimeter margin compared to a 5 millimeter margin, for instance, the more normal tissue you have around the melanoma in situ, for instance, the lower chance you have of it reoccurring. But of course, the flip side of the coin is that also immediately means a much larger scar. So now it depends on where on the body it is, and do you have the luxury of going quite wide, or do you, let's say, is it on the nose where we're stuck, that we can't go with liberal margins. Also, let's say if it's on the face, ears, Mohs surgery, the chances are very, very low that you're going to have a reoccurrence. But as I say, let's say if it was a lesion on the body, let's pretend that it was only a 1 millimeter margin, then I mean there is that 1 to 2 to 3% chance that one can see a reoccurrence. And of course the treatment is exactly the same. The question is just sometimes, is it a new lesion or is it a reoccurrence of the melanoma? Because again, it's still in the skin. Luckily rare. I mean, I think the short answer is luckily it's very rare, but of course it can happen.
Thanks. And we've had a number of questions talking about sunscreen and the level, the SPF level that would be recommended to use.
Yeah, so typically anything between a 30 and a 50, but the tricky part there is to make sure that you use enough volume, because otherwise we get a little bit fixated on that SPF number, but because I'm not using it liberally, unfortunately the SPF value drops. So that's why I say yes, the SPF value is important. And the problem is just the higher the SPF value is, the thicker the product typically is, which means that you don't immediately use less. So I think the magic number is typically around 40 or 42, 45. But get a product that you like and that your skin can tolerate, so that you can use enough sunscreen on the skin that doesn't cause irritation, but also that that you do get that adequate SPF value that is going to protect the skin.
Thanks. And we've had some questions as well regarding your conversation of the full body photography. And one of the attendees was curious regarding full body photography, but in the scalp region, and someone presenting with thick hair.
Mm-hmm.
What would that I guess look like in terms of full body photography?
Yeah, that's a hairy subject. It's a difficult area. So no, so full body photography is not going to help there. The full body photography is great, but again, there are certain areas of deficiencies. The scalp is definitely one of them. The creases of the body, for instance, is another area that's very difficult. None of us are built like the supermodels that we see on the front page of certain magazines. So again, body folds, hair. Luckily, now the good news is that the full body photography is just getting better and better. Previously, there was always even difficulties in between the fingers, the palms, the soles of the feet, but that is getting better. But the scalp is always difficult, and I think that's where my recommendation is when you see your stylist who's helping you with your hair, always remind him to say, hey, I've had melanoma anywhere on your body, or I've had skin cancer anywhere on my body. Do you mind, just while you're busy with my hair, just checking my scalp? You are busy with it. And again, I mean, we also need to remember not everything that looks weird or different on the scalp or on the skin is skin cancer, but just help me to be aware of it. Maybe take a photo of it, or when you see your family doctor, just show them what is new and changing on your scalp. But again, very difficult area to examine, especially when we have thick hair. But it is an area that we need to check. And that's why I always say, when you've had skin cancer, specifically melanoma, there's 3 people that needs to help me with their screening. The first is your stylist, your hairdresser. You're always going to help them to say, hey, please, I need your help. The second is your ophthalmologist or your optometrist to make sure that you get an eye check, because of course you can get melanoma in the eyes. This is not sunshine related, this is genetic related. And the third person is your dentist. So again, you know, when you see your dentist, just remind them that you've had melanoma so that they can look at the perioral area and make sure that there's nothing suspicious there as well.
Thank you so much. And again, just going off of the questions with the total body photography, we have some attendees wondering if this is covered or is there a fee?
Yeah, good question. Unfortunately, not covered. I think this is probably one of the most frustrating things about you know, the newer technology that we have. Depending on where you are, a lot of tertiary educational centers, like the universities, they do, let's say the dermatology departments, they might use different types of full body photography. Of course, I just showed you guys the one that we use, the photo finder, but there's a few around. Interestingly enough, there's also, because again, the photos that I've showed you guys in the video, those are all 2D imaging, but there's actually now 3D imaging that you get, which is even better. But the technology is not there yet to use specifically. But again, it's these teaching type of settings that offer this. But no, unfortunately, this is not something that's covered by your extended health or by your province. In most cases, this is a private fee, and it can literally be anything between $300 to, I think, upwards of $800 a session, which is very, very expensive and very, very frustrating for our patients. I mean, I always say, you know, we help where we can, but it is definitely one of those things where it would be awesome if it was, you know, covered like your regular screening, like let's say mammograms and pap smears and colonoscopies and stuff like that.
Thanks so much for sharing that and clarifying for our attendees as well. And lastly, there were questions regarding your experience in clinic with acral melanoma on the heel, and what you know to be the reoccurrence rate after this has been treated. Do you have any insight regarding that?
Yeah. You know what? It's luckily, again, very rare. I don't have a lot of experience with it just because it is so rare. It is a more difficult type of melanoma to treat. But again, the question there would be is what the breast lobe thickness is, was there a sentinel lymph node done, because that will immediately tell us what the reoccurrence is. So I think a lot of patients would immediately, when they're diagnosed with a melanoma, the first question is, what is the chance that I'm going to die? And the second question is, what is the chance that I'm going to get this again? And we do know that the thicker your melanoma is, the higher chance you have of getting more melanomas. So, so if it was a superficial melanoma, of course, you still have a chance because this is also genetically predisposing. But again, when it's very superficial melanomas, that's always, it's very, very frustrating, of course, to get the surgery. But at least in that sense, you know, you didn't need any more invasive type of treatments.
Thank you so much. Well, that concludes at this time our question and answer period. So thank you everyone for submitting your questions.